Hello, my name is Marcus Chavez and I'm with IFARA TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by Christine Danel, who is with the interim in Bordeaux, France. Christine presents the results of the Temparo study. The Temparo study was a randomized controlled trial that assessed the benefits of early ART and/or early IPT among HIV-infected adults with high CD4 counts and no WHO criteria for starting ART.
Thank you very much. As you know, since 2012 and 2013, the WHO has recommended to start ART when CD4 is below 500. By the way, tuberculosis is the first opportunistic infection in resource-limited countries. WHO then has also long recommended prescribing 6 months of isoniazid preventive therapy to all HIV-infected patients with no active TB. However, this recommendation is not applied in Côte d'Ivoire as well as in many other countries because of difficulty in ruling out active TB in HIV-infected patients and the concern for resistance to TB drugs. So, Temparo trial is a large multicenter randomized control trial that will launch in Abidjan, Côte d'Ivoire, conducted by Ivorian and French teams and sponsored by the French INRS. It was conducted in 9 healthcare centers between March 2008 and January 2015. HIV-1 infected adults were enrolled if they had CD4 count below 800, and on the 2,056 patients analyzed, 41% had CD4 count above 500. Patients were randomized into 4 arms combining the 2 interventions, immediate ART and 6 months IPT. In arm 1 and 2, called WHO ART arm, patients receive ART according to the most recent WHO criteria for starting ART, and in the arm 3 and 4, called early ART, with the ART was prescribed immediately. And in the arm 2 and 4, patients receive the 6 months IPT, start 1 month after entry. In all groups, first-line ART was tenofovir, emricitabine, and the third drugs, efavirenz preferably, or a boosted lopinavir regimen of zidovudine. The main outcome was severe HIV-related morbidity, defined as all cause of death, all AIDS-defining events, invasive bacterial disease, and non-AIDS cancers. The results was that both early ART and 6 months IPT reduced significantly and independently severe HIV-related morbidity, with a 44% reduction of severe morbidity in early ART compared to WHO ART, and a 35% reductions of morbidity in IPT arms compared to no IPT arms. When we analyzed patients with CD4 above 500, these results remain significant for early ART. Thank you very much.